Welcome to the pharmaphorum podcast. This is web editor Nicole Raleigh, and I am live on site in Cornwall at Anthropy 2025, Rebooting Britain, once again held at the Eden Project. With me is David Gillen, Chief Medical Officer at Norgine. Welcome, David.
Hi.
So, Norgine is a leading European specialist pharmaceutical company that has been bringing transformative products to patients for over a century. Committed to transforming people's lives, Norgine's fully integrated infrastructure and partnership approach enables the company to quickly apply creative solutions to bring life-changing products to patients that they may not otherwise be able to access. David, you've just been on the panel run by Adelphi Group that was entitled The Prevention Revolution in Your Healthcare. And I'd like to sort of cover some of the key takeaways from that discussion for listeners today, discussing the exciting possibilities of prevention and some of the promising, if radical, initiatives explored. So prevention is increasingly seen as contributing to a healthier and more productive society. But as healthcare resources are stretched and medical science is accelerating, how do we make prevention a reality?
Well, I think meetings like this help. I think I think that the panel today was very broad and very demonstrative of the interest, which, I obviously work in the pharmaceutical industry, but we had charity sector, we had patient advocacy sector, we had the NHS, and I think, prevention, speaking parochially about the UK, is a multi-team effect. We need to work together across the sectors to try and help prevention, whether it be primary prevention before there's any obvious disease, or secondary or tertiary prevention when there is disease and we're trying to reduce or prevent recurrence or relapse or advancement of the disease. So I think it was a very intense 1 hour. It would have been nice to have a bit longer, I think, if I'm honest, because I think there was so many good thoughts coming through. But it was a great start to a conversation. I know Adelphi's been focused on this for some time, and it was great to be part of it.
They have indeed, and as you say, it was an intense hours panel. But perhaps you could, for listeners, dive into what prevention, in terms of the discussion today, what prevention actually means. I mean, people, when they hear the word prevention, have a high expectation. But precisely, what does that mean?
Well, I think prevention means delaying or stopping a disease process. Okay, so when I say prevention, I think what we would probably automatically think, wherever you are in the pharmaceutical industry, you probably think vaccination as an example of prevention of disease. And I would say, honestly, that vaccination is probably the greatest advance that medicine has made to society in the last 150 years, honestly. I'm being, maybe it's a big statement, but if you think about it today, I think second only to clean drinking water, vaccination has a huge impact. I think, it will prevent up to 4 million deaths this year globally, vaccination. So vaccination is an obvious concept, but my personal area in the past was in cardiovascular disease. So, I would argue that, as well as lifestyle changes, which are critical, before and after any sort of cardiovascular event, medicines such as statins or medicines such as antihypertensives or clopidogrel or aspirin, they are all critical parts of the partnership that the pharmaceutical industry has with the health system in trying to prevent cardiovascular disease to start with, but then prevent it coming back.
Absolutely. Before we dive into pharma's role specifically, You mentioned cardiovascular, and on the panel today also was Professor Ben Bridgewater. And my next question was going to turn to this fact that healthcare systems are increasingly seeing the health, social and economic benefits of prevention.
Yes.
But when delivered in an evidence-based way.
Yes.
So I was just wondering if you could comment on how critical this evidence-based aspect is in putting those preventative measures into place.
I think it's absolutely critical. I think, wherever you work in the sector, health sector, you need increasingly, and we increasingly have access to astonishing data. It's one of the advantages that the NHS has, is this enormous data set that allows contemporaneous interrogation and understanding of disease through electronic health records and other means. And that's really what Ben is leading in Manchester, and it's very exciting what he's doing. And he's also doing what I like a lot, obviously, partnering with, I think, Lilly in this instance, in terms of looking at the effect of interventions like GLP-1s on obesity and cardiovascular disease. And I think that is absolutely the right model and very exciting. And he's using remarkable data sets to do that. And I think we will see really meaningful data coming from that. I think back again to areas I've worked in the past, and the heart protection study was a very big clinical trial run several years ago by the Oxford group, and that was, I think, 25,000 patients. The data that Ben's going to have is going to dwarf that, and that's remarkable. So I think it'll really make a difference in terms of really understanding the true benefit of interventions like lifestyle and then, where appropriate, pharmaceuticals.
As you say, it's this scale factor. Professor Bridgewater also mentioned that as a cardiac surgeon, his previous life, he perhaps performed surgery on some 3,500 people, whereas in his life in data now, that's exponentially more.
Yes, exactly right.
So let's bring it back to the pharmaceuticals, to the medicines. So pharma has a crucial role to play, as was discussed on the panel, by producing safe and effective medicines that are in some situations preventative, or by supporting initiatives that are preventative. So can you tell us more about clarifying both those roles of pharma?
I have a slightly different view of this.
Okay.
I have to say, I think that the pharmaceuticals that I've talked about already, and generally, they are pretty much trying to prevent disease. Either they're trying to prevent the disease carrying on. So an antibiotic is trying to prevent a chest infection, trying to reduce the time the person has symptoms. A statin is trying to prevent another heart attack or another stroke. A vaccine is trying to prevent an infectious disease. So I feel that the pharmaceutical industry, by definition, is developing interventions which are dealing with illness, but they are trying to prevent the illness getting worse or trying to prevent the illness happening at all, in most cases.
As you say, it's hitting across primary, secondary and tertiary.
Yeah, and I think that, I was the tertiary, I think that's exactly what's the point, and so I think we can make it to breaking it down and keeping it simple. I think that's what pharmaceutical companies are trying to do.
Thank you for debating me on that, David. No, I think it's good for listeners to know the industry's viewpoint on it, working as they do so closely, not just with the development of the drugs, but with the people and the clinical trials as well. So if we turn back to the Intense panel, sponsored by Adelphi Group, what were your key takeaways from that explorative, impassioned discussion?
Well, I think I've mentioned, I think it's a team sport and all the right people were in the room. I think it honestly requires more than an hour to do it justice because it's such a big subject. I think the area that we didn't really have time to talk about were the areas beyond therapeutics. And we touched on it briefly, which is lifestyle and, whose responsibility is it? And fundamentally, it's probably the individual. But what can society do to help that? And, that's not really a question for me as a pharmaceutical professional, but it's a question for me as someone who's interested in health and has a medical background. And I think there's a huge amount that we should be doing better as a society in education at an early age around illnesses without terrifying young people. It's important, And, there was a brief conversation at the end today, which was a shame because we didn't have time, where really I started to talk about alcohol and cigarettes and those things that are there, and bad food and inequality of health, which I think are hugely important subjects in the context of prevention. When I was at medical school, we talked about the inverse care law, which is true today as it was then. And it was initially described by a doctor working in the Welsh valleys, but it's true today. And unfortunately, the poorer parts of society in these areas, in cardiovascular disease, in oncology, many areas of oncology, they do worse because of that inequality. I think that's a topic that we should talk about perhaps a bit more as a collective as we go forward.
We should indeed, but let's not forget that we're here at Anthropy UK, which this year is focusing on rebooting Britain. And perhaps to do justice, as you say, the panel could have been a 2-hour panel. So if we think of Carly Santer's position from Bear, she didn't really get a chance to do justice to this issue of sustainability. So as my closing question, David, in terms of Anthropy UK's endeavours and Bear's endeavours, Carly's endeavours, what next for sustainability in terms of what we've been discussing with prevention and the UK's health? And I'm going to separate care from health, because we talk about NHS and sick care system, and Stuart Cooper of the Delphi Group today was discussing quality of life and how important this is in prevention, particularly with an ever increasingly large ageing society. So what next for sustainability, for all the aspects to be hit in a positive manner?
Wow. Sustainability. I think it's a huge subject in life, let alone healthcare, let alone pharmaceuticals. Carly, unfortunately, didn't have much time to talk about what she's doing, but I think what she's trying to do is predominantly in the clinical trial space. And I think that's very exciting. And I think that one of the things we've learned from COVID was that we're able to do more and more decentralized trials. So just to very simply put, that's allowing us to work with volunteers in trials without them having to travel big distances, often depending on the country, to a clinical trial centre or to their clinic, but instead use wearables, use different methods of monitoring the patients to allow them to be, more local to themselves, which is good for them, but it's also good for the environment. So I think that's just an example I think she would have talked about a little bit. And I think that's what we're all doing a bit more of. The cost of that, is huge. The other piece of sustainability that I think about in the context of where I work is the utility of technology to avoid maybe, face-to-face meetings and, medical education events. We're able to do them much more now with technology, which avoids the need of travel and all those things. So just from a climate sustainability, I think that's what she was going to talk about if she had the chance today.
Yes, well, you travelled by train to be here, David, so you're well on the way to green kudos. Thank you very much for conversing with me. It's been a pleasure.
Oh, it's very nice to talk to you. Thank you very much.
And so that concludes another episode of the pharmaphorum podcast. You can find more information about this episode, including a download link and information about previous instalments at pharmaphorum.com/podcasts. The pharmaphorum podcast is also available on iTunes, Spotify, Amazon Music, Podbean, and pretty much wherever you get your other podcasts. Just search for pharmaphorum and press subscribe. Of course, don't forget to visit our website itself, where you can sign up for daily and weekly news and analysis bulletins. And do follow us as well on X or Twitter and LinkedIn at pharmaphorum. That's all for now. Thank you for listening.